Welcome to the Buchanan Area Senior Center. My name is Diana. I'm your program coordinator here at the center. We are so pleased today to have Mary Peters. She's an RN from Spectrum Health Caring Circle, and she's going to talk to us about ways that we can prevent falls, what to look for, and all the great information that we need just to have, for we can have a healthier and happier life. Mary Peters, I'm going to hand it off to you.
Thank you.
Thank you.
Okay. Take my mask off because we're all spaced out, okay? So, my name is Mary Peters. I'm a nurse with Caring Circle, hospice nurse, and I've been with them for 14 years at this point. So, before that I was working for Area Agency on Aging, and I worked for them for 8 years. So, most of my nursing career has been with geriatric patients, and so we are doing a falls prevention because prevention is a big part of it. So you've been handed out a program today so this is pictures of our slides so that you can follow through with the program there, and you can take notes if you like. I want you to be able to take that information home, share it if you need to, and be able to have it where you can actually reference it. So let's see, which button? The next one? Oh, there we are. This is our disclosure statement. It's just saying that Hospice at Home has created this program for your information in the public and for your private use, and we're not gaining any money. We're not charging anybody for this information. It's just to share with you. So we have some learning objectives. We're going to identify the leading cause of most falls, and we're going to cite important questions asked in a fall risk examination. We're going to identify 6 steps to prevent falls and describe 4 elements of strong mobility. We're going to discover if there is anything that you can do about declining mobility and falls, and we're going to prioritize 2 key aspects in your day-to-day schedule to help prevent falls. Life-changing circumstances, and it happens just like that. You slip in the shower, you trip over a rug or a dog toy, and you stumble on uneven ground in the yard, and you could break a bone, like thousands of older men and women do each year, and that's when the cascade of events starts. A trip to the hospital, an injury, or even a disability. More than 1 in 3 people over the age of 65 fall every year. So this is a common thing. So let's look at the statistics about this. Every year, 3 million people are treated in the emergency department. That's 1 person every 11 minutes that are related to falls. That's pretty sad. Every 11 minutes. Nearly 1 million result in fracture of the head, fracture of the leg or the head, a major injury. 1 out of 5 result in serious injury. And you imagine if you hit your head in the right place and the right strength to it, you could have a brain bleed that would affect how you live, how well you get around. It could be very serious. So we want to prevent this as much as possible. So in 2015, the total cost to Medicare and Medicaid was $50 billion. And that rate is increasing each year. Loss of mobility, growing older, lower physical activity, obesity, impaired strength and balance, chronic disease, diabetes and arthritis, depression, and memory issues. These are all common factors that lead to falls. That affects Americans everywhere. Are you asking a question?
No, it just looked like, was there a skip of one of the...
Oh, I probably...
Oh, you didn't advance.
I didn't advance.
That's...
There we go. Okay. Let's go to the next one. Oh. looks like we're missing this one. I put a slide in here for facilities. Patients at risk for falls need to be identified at the time of admission. The patient room needs to be near to the nurse's desk. The bed alarms and bed rails do not prevent falls. I didn't even know that. They don't prevent a fall. They tell you that something's going on, so you hurry down to the room. Frequent rounding by the nurses and the nursing staff is statistically the best prevention of falls. Patients should be in a low bed, inches from the floor, and a fall mat should be in place on the floor. So now we're back in line with the fear of falling. Okay, so there is something called the fear of falling, basophobia. It's called, it's unlikely as it may seem, just the fear of falling can become a bigger problem to your already unsteady gait. Diseases like Parkinson's disease, Alzheimer's disease, multiple sclerosis, and recovery from a stroke are all common disease processes. But on top of that, when you get the fear of falling, you stop ambulating as much as you did. And that just increases the cycle. And then it gets worse. We need to be mobile. I saw you guys over here this morning doing exactly some of the things that we're going to recommend here. Excellent. Good job. Good job. If I had been part of your group earlier, I would have joined you. Let's click ahead. Medical providers focus on major disease processes and often miss declining mobility. Why is this too important to miss? Because it means the difference between living at home or living in a facility for a lot of people. That's pretty serious. That's a major change in your life. So, this is the get up and go test. A simple 2-question test can reveal the answer. Standing up from sitting in a chair and walking 10 feet and turning around and coming back. So the doctor is watching if you're needing help getting up, or if you need to pull up from a table and steady yourself, or they're watching if you can just stand up. So that tells the doctor a lot. And then how you walk, if you just are able to keep your balance and so forth, and turn around and come back to the chair and sit down without touching anything, that's the best, okay? Some people need help, and that's okay. If you need help, definitely use those little helpers and prompts to keep yourself safe. But it's part of the 2-question test. The second question is, do you have difficulty climbing stairs or walking 1/4 of a mile? So that part is it's not a demonstration. It's only a yes or no, or, you're answering the question. So this 2-part test a lot of times is missed by the physician because they're thinking about heart disease and diabetes and things like that. So they may not think about saying, hey, this is a new issue for you. Now you're using a walker. What's going on? Let's do a test, okay? But you could ask him to evaluate that. So did that test scare you? Were you thinking about someone you love? Were you thinking about yourself? Good news, this can get better. Okay. So we're going to ask our physicians some important questions. Your provider can help you address what's causing the difficulty before the problem gets progressed into a loss of mobility. He can offer occupational therapy. They help to improve a person's ability to perform daily living activities like toileting, showering, and dressing. Physical therapy improves balance and strength training. So either one of those could be offered. Social support can help eliminate mobility barriers with a lack of transportation. So if you are at a point in life where you can no longer drive yourself because of your vision or dizziness, or you just don't feel safe on the road or something like that, then that's a huge transition. And you have to rely on somebody else for mobility. That is a huge one. So let's go to our next slide. So Benjamin Franklin said, an ounce of prevention is worth a pound of cure. So what are we going to do to prevent these things from happening? Number one, 6 steps to prevent falls. Number 1, find a good balance and exercise program, like they had here this morning. Look into building balance, strength, and flexibility. Contact your local area agency on aging for referrals. Find a program like you like and take a friend. So it's always more fun if you know the people you're with and you can feel like you have a friend there. So these are at your local senior centers, they're at the Y, different places, some church groups do them. So it's really important to be involved that way, and not only psychologically, you're touching base and making friends, but you're also moving, and that's so important. Talk to your healthcare provider, like we just talked about in that other slide, and he can help you if there's something going on. Medications. All right, number 3, regularly review your medications with your doctor or pharmacist. Every medication that you take has some kind of side effect. So when you get, a whole list of medications, the doctors and the pharmacists are there to make sure that they're not interacting with each other, or maybe you don't need that strong of a dose any longer and it could be cut back. So they're the people that are going to help you keep safe with your medicines. So every time you go to a doctor, you want to take your medications with you, or at least a medication list. And if you're having problems with keeping track of them and need some help, they're the ones that can help to make those arrangements even in your home. Okay, number 4. I'm gonna go, there we are. Number 4, get a vision and hearing test and check annually, every year. Update your eyeglasses. So our vision ability and our hearing have a lot to do with how good our balance is. And if we just think, oh, well, I live by myself and it doesn't really matter that I can't hear very well, your mental cognition is going to decline quickly if you can't hear. You're not hearing and processing what other people are saying to you. It all has to do with our balance and that kind of thing too. So we need to check our vision and our hearing and make sure we're taking care of that. Keep your home safe. So that's the steps. So we need handrails, we need to keep the walkways clear, we need intervention in the bathroom, in the bottom of the shower, that kind of thing. Talk to your family members. So you're going to get a support team going, right? You're going to have that neighbor friend or your kids or whoever it is that's helping you stay at home. You're going to make sure that they're aware of what's going on and that they're going to help you to get your home ready and things. Do you have a question?
On that number 4, could you explain more about the hearing and balance or something that you mentioned?
Okay, so our vision, how well we can see, and how well we can hear have to do with our balance and our ability to move. So it's hardwired in our brain that way. So we need to get our eyes tested and our hearing tested and keep up on those things, because going deaf or hard of hearing is not just because I'm aging. There's something going on and we need to get it fixed, right? We're going to talk to our family. So we're going to go to the next slide. How do we avoid the pitfalls along the way? Okay, so in medical care now, we see our primary physician, we see a cardiologist, we see a podiatrist, we see a dermatologist, we see a urologist. So there's all these specialty physicians that our primary care is sending us out to. So we want to make sure that they're communicating with each other, right? So we don't have doctor number 3 ordering something that he doesn't realize is going to interact with something doctor number 1 has ordered, right? So we want to make sure that they're communicating with each other. Multiple doctors can create difficulty if the providers are not talking to each other about your care. Review medication lists at every visit. Bring medication bottles if you need help getting organized with your medications. Carry a complete list of your medications and your allergies. Chronic conditions such as diabetes, heart disease, and arthritis often increase the risk of falls due to loss of function, inactivity, depression, or pain. So if you have other diagnoses, it's always a bigger risk. Oh, how many of us has this place in our house? I do. This, we have all have these places in our home where we stash things that are on their way to where they belong. This creates a hazard and can be the cause of a fall or an injury. A pathway and stairs should be clear of clutter and well lit. Handrails should be installed. So I don't see any handrails up in that stairwell, and the laundry's stacking up there, and you've got a launder basket there. All that's in the way. It's setting it up, just setting it up for a bad fall. Okay, so we're going to start to do something about this. We're going to take a stand against sitting. So I'm going to stand up now. Have you heard that sitting is the new smoking? The heart rate is slower, breathing is shallow, so you're only breathing a little bit, you're not expanding your lungs. Circulation is slowed down, metabolism is slowed down. This is promoting health or illness. Which one? Illness. Yeah. So this sedentary lifestyle where we're just going to watch TV show after TV show. I might stumble into the kitchen to get a brownie. But most of the time we're spending sitting. Even those of us that are still working, a lot of our work is on the computer. We're sitting, we're slouching our shoulders forward. We're not exercising, we're not getting up and moving and using our muscles. We're not filling our lungs like we should. We're not increasing our heart rate. Yeah. So all of these things don't help in maintaining health. So we want measurable mobility. So I'm going to say, if I set a goal, I need to be able to measure whether or not I'm reaching that goal. So just to say, I'm going to exercise more is not sufficient. How often am I going to exercise? How long am I going to exercise? If I miss it today because I had a doctor's appointment, am I going to do it tomorrow instead? Or am I going to let it go? Right? So these are important questions. So measurable mobility, they're suggesting 30 minutes, 3 to 4 times a week. So how often is your exercise class here?
45 minutes.
45 minutes for how many days a week?
Well, that one's just.
Well, we have exercises,
Every day.
we have 6 exercise programs.
6 exercise programs. Excellent, excellent, I love it. Okay, so schedule your exercise daily. And walking
Actually, we have
is,
7. Sorry.
walking is the excellent exercise. Gardening is even better. Okay, I don't know how many of you garden, but that's even better. Okay, if you miss the exercise that you scheduled due to the pressures of life or other scheduled events, then you say, okay, I'm going to do that tonight instead of at 10 o'clock in the morning or whatever time. Or I'm going to do it tomorrow instead of today. But you make a plan for it. It's important. It's so easy for us to just say, oh, I don't want to do that, I'm just gonna sleep today. And that's okay, but tomorrow, get up and do it. Okay, strength, staying physically fit. So even the weakest patients after surgery or some illness in the hospital can benefit from strengthening exercises. You can use your water bottle if you need to. You could simply make some movements. Join a fitness club with a friend or make new friends there. Balance exercise, Tai Chi meditation, standing on one foot. The heel to toe walking, that's where you go on the heel to the toe, heel to the toe, heel to the toe. And of course, if you need to use a walker or a cane as you're doing this, do. But you're intentionally stretching those muscles, even if you stand on a stair and let your heels hang off a little bit. So you stretch this. You're holding the wall or the grab rail, but you're stretching this back calf so that it's not so tight. That's going to help your ankles as you're walking and stuff like that. Heel to toe walking or standing on your toes and then down, standing on your toes and back down, and so forth. Standing up from a seated position. This is what I was showing you earlier about the test. Remember the test? If you have your hands in front of you and you can stand up and you can sit down. If you do this several times a day, it's not just our legs. You know, we think, oh, I fell because my leg gave away. But it's our core. It's our whole middle section here, in our back and across this way. Okay? So just sitting and standing, and sitting and standing. And if you need the support, use it. But we need to move every day. That's how we're going to get stronger. Okay, so flexibility and range of motion. So have you ever seen somebody walking in the store and they look exactly like they just came out of their chair? It matters where our head and our shoulders are, okay? So what you guys were doing over there was ending the exercise time was great. So even just sitting in our chairs here, we can roll those shoulders. Can you feel that kind of, get that loosened up, go the other way. Okay, so when we're standing, if we think about it, and we need to think about it more, our ears should be over our shoulder, which should be over our hips, which should be over our feet. We should not be like this. That's harder to walk when you're like that. So our posture has a lot to do with it. So you were doing some of the stretching exercises. I had shoulder impingement 2 years ago, 3 years ago. I was carrying my bag for work with my computer in it and all the stuff that I carry in and out of patients' homes, and I got to the point where I could not lift my arm without pain. So even this was terrible. And I had like stress injuries in my hand, I'm right-handed, in my hand from too much work, and then in my elbow from too much work, and then it went to my shoulder. So all of this, I finally said to the doctor, I need to go to therapy to get this back so I can with my arm again. So she sent me to therapy, and the exercise that was so helpful for that was simply to lay on the floor and stretch my arms out. That was not hard. That was not hard at all to do that as an exercise. But it changed the fact that I could then start to stretch out here. As we're standing improperly with our shoulders hunched forward, these muscles are getting short and these ones are getting long. So if we don't reverse that and stretch like that, we're going to become shaped that way. Okay? All right, let's see. Well, those are the exercises I was talking about. If you can get down on the floor and stretch these ones, that's good. If not, just these and this here, even this, you can do from a chair. My husband is in a wheelchair, he's a paraplegic. So these are still very important for him because he needs to keep strong and mobile up here to manage, because he does not have use of his legs, right? So it's very important. Okay, quick tip, test your exercise intensity. When you're being active, try talking. If you're breathing hard but can still have a conversation easily, it's moderate intensity activity. If you can only say a few words before you need to take a breath, it's vigorous intensity activity. You should be in the moderate level. So you're not hurting yourself. It's not that you're going to do the P90X exercise program. That's not it. So you just need to start wherever you're at and start adding some mobility to your day, but you need to do so that you could still carry on a conversation, okay? Safety tips along the way. Warm up and cool down. Do light activity before and after working out to warm up and cool down. Listen to your body. You should not be dizzy. You should not feel chest pain or pressure. Stay hydrated. Sweat is loss of fluid that needs to be replaced. Check with your provider if you have been told to limit fluids. Be aware of your surroundings. Know where you're at and how to get back to your group or to your car. So if you decide you're going to go walk in the park and you go with some other people and you find yourself alone, all of a sudden they're down the path farther, just be aware of where you came in at and how to get back to where you need to go. Okay? It sounds simple enough, but how many of us have lost our car in Walmart parking lot? Okay, start low and go slow. Increase your workout over time to prevent pain or injury. So, like I said, the best exercise is walking. Even when you're younger, the best exercise is walking. It's not a full-out run for 3 or 4 or 5 marathon miles. It's walking. So, or gardening. So we're going to eat right. That means the colors of the rainbow, right? It's not just macaroni and cheese, but the whole rainbow. And we're going to hydrate. So we're going to drink enough water to keep ourselves healthy. We want to be a part of community. We are social, emotional, physical, and spiritual beings. Being part of a community is about connecting and enjoying life. So if we're not going to do something that we enjoy doing, we're probably not going to keep it up, right? So, okay, plan for it. Fall prevention checklist. Secure floorboards and rugs to the ground with double-sided tape or non-skid pads. Keep the items you use frequently, such as dishes and food, within reach so you don't have to rely on a stool. Just the other day, at our church kitchen, we had a fancy fold-out stepladder, And one of our gentlemen said, "Oh, I'll get that off the top shelf." And he almost fell. We got a new stepladder. Yeah. Get your vision and hearing checked regularly. Check all smoke and carbon monoxide detectors regularly. Improve the lighting in your home, especially in dim areas like in the hallways and the bedrooms. Keep emergency numbers in large print near each phone. Place non-skid mats in showers and bathtubs. Be mindful of medications. Some may cause a loss of balance and coordination. Wear shoes with traction both inside and outside the home to avoid slipping. Install grab bars where needed. Keep yourself active to strengthen bones and improve flexibility. What to do if you fall? Breathe. Take several deep breaths and try to relax. It's very unnerving when you fall. So all of a sudden you're laying down there. So you just need to take a minute, okay? You're already down as far as you're going, so you're not gonna you're not gonna continue falling. Decide if you're hurt before you get up. Roll over onto your side, get up slowly onto your hands and knees, and crawl to a sturdy chair. Use a chair and put your hands on the chair seat and slide one foot forward so that it's flat on the floor. Keep the other leg bent so the knee is on the floor. Rise up and turn your body to sit in the chair. Ask for help if you're hurt or need help getting up. Get help. Carry a portable phone or wear an EMS button so that you can call for help if you need to. I'm going to demonstrate how to use the chair like we just talked about. So if I'm on the ground, I'm going to get up so that I'm on my hands and knees, and I'm going to crawl to the nearest couch or chair or something that's sturdy enough to do the job. So I'm going to grab a hold of the seat and I'm going to pull one foot up like this, and I'm on the other knee. So I want to pull myself up onto the chair and turn and get up on my hip and then scoot up to my bottom. So then I'm up off the floor. And if it takes a while to do that, that's fine. It doesn't have to be in 3 seconds, but if you need help, you need to be able to call for help. So you need something handy and a plan, right? You need a phone or an EMS button, and you need to think about how you would get yourself up before right? And if you have broken something or you have pain, you certainly need to call EMS and get them there to assess you, okay? And it may get better on its own, but if you need help, call for help. Be willing to ask for help. Because the best years are now. We're not guaranteed tomorrow, right? We're going to take care of ourselves, be healthy, be strong, be happy now, right? So we're going to review those 6 steps that we talked about earlier. So we're going to get into some plan of movement. We're going to join some group that has physical activity. We are going to visit our physician, and we're going to assess our medications. We're going to get our vision and our hearing tested so that we have better mobility. We can tell what's going on around us. We're going to make sure our stairwells and our pathways in our home are clear, right? No carpets in the way, no little throw rugs that are pretty but not very functional. Let's move those out of the way. Make sure there's no blankets or stack of laundry or the dog's bone or anything like that that's going to cause a problem in the way. And then we're going to get our families involved so that they can help us to make a good plan. Any questions that we would like to ask?
What if, I know there are some people regarding families that maybe they're real far away or something, or maybe people don't get along, so what other types of groups would you, who else could be your support system besides family?
Okay, yeah, we don't live in that nuclear family in 3 generations in a home anymore, you know. So a good friend or a neighbor, maybe somebody from your church, or, you know, that you have met and you're taking care of each other. You know, you're checking in with each other. It's that kind of a person and that kind of a relationship that I'm talking about. So, yes, as we...
People are busy.
People are busy, yep, yep,
They don't have time.
yep.
Well, you can make a pact with other friends, to say, okay, we're gonna check on each other every day at this time or something. That, you have to be proactive and develop those kind of relationships and say, okay, because you might have somebody where you live at, they might be in the same situation. So you say, okay, you know what, you don't have somebody, and I don't have somebody, so let's make sure that we check on each other. You don't mean you have to go hang out, but it does mean that you are checking it.
So that's what she said, just on the microphone, in case you didn't hear her, is being proactive is important, and finding that buddy or partner or friend that can help watch you and you watch them, and you see if your neighbor is coming out to get her mail and things like that. So, the light's gonna go off in your head and say, oh, I wonder what's going on, she hasn't been out for 2 days. So, you're gonna be checking on her, that's good. My dad is 89, lives at home independently. He's very, very healthy for the health he's in. He has his problems, but he is able to live independently, but I check on him several times a week. My daughter checks on him several times a week as she's coming through town. So, we tag team him in a support system so that I'm not having to be there every day and she's not having to be there every day, but he's getting the support that he needs. Yes?
I learned something, I don't know where I heard it, but colored paper in your window, when in a neighborhood situation, if you put the green one up means you're fine, and you put the yellow one up in case, you want someone to come. Or,
Hold on.
Say that in the mic.
Go ahead. I didn't want to be the speaker. I heard somewhere, it's a paper situation where if you're in a neighborhood, you can put the green piece of paper in your window, meaning that you're fine, everything is okay. And then when you're maybe not feeling well and you want some help, the yellow one goes up, and if it's really, really bad, the red one goes up, and your neighbors know, okay, Mary's having trouble, or whatever, and that works.
That's a good idea.
I like that. I like that. Okay, so we're gonna go and we're going to start thinking about what we can do in our lives to be proactive and make a plan so that we're not going to be stuck on the floor somewhere, right? We're gonna move, we're going to eat healthy, we're gonna drink our water, we're gonna make a plan. EMS, cell phone, or an EMS button, something, so that we're not going to end up on the floor and not able to call. All right? Yes?
How do you encourage people with that EMS button? Because there are a lot of people that are, and you kind of mentioned about the front, you didn't say front, but be willing to ask for help. Some people are just, they feel like they're just too proud to need.
Oh, that was something that you just triggered my memory, is that when we're seeing our physician, we need to tell him. I fell again last Tuesday, so that he can start to cue in that, in the last year, I have fallen 3 times or something. You need to be having this discussion with him so that he can start to help to unravel some of that. Is it disease process? Is it result of medications? Is it just aging? But how can we start to stop that and reverse it? So, yeah, I know, I've had that discussion many, many times, and it's a difficult one because they feel like, oh, I don't need that. I don't need that. So then what is the alternative? What is the other plan? Right. So you know, because falling becomes an emergency. Yeah, and we, you know, as we're going down, and that, you know, 2 or 3 seconds it takes to hit the ground, and you're thinking, oh man, here we go. You know, it doesn't take but just a few seconds, and suddenly it could be very different for you. And so those people, I say, when they're resistant to the now 911 buttons and the emergency response buttons, I say, okay, so where's your cell phone? How are you going to keep it on your person? Are you going to get one of those pocket things that hang on your neck? Are you going to wear a shirt, you know, that has a pocket? You're going to carry it with you in the house. You can't just leave it lay by your chair, because if you're in the bathroom, now we have a problem. So talking through the other alternatives is a good idea, as a friend even, not as, you know, you have to do something, but bringing them through the thought process is very helpful. Anybody else? Yes?
Do you teach how to fall?
No, I hadn't really thought about that. I do know.
Football players.
I do know that if you put your arm out like this, and it's a fall onto the arm, that's a green stick break. And my son did that when he was probably 16 or something like that, and there's 2 bones in the arm, and they broke and came like this. So he had to have plates. But you know, this is not a good idea.
Tuck and roll.
Tuck and roll, yeah, and not just clunk, I hit my head on the floor. You know, if you can roll out of it, you might be a little sore afterwards, but you're going to be less traumatized by that kind of a fall that's, you know, than smacking your head on the ground or something like that.
Your elbows will be a spring.
They're a hinge bone, so
But when you're going down,
yeah, that's a strong part of your body, but I would not want to land on my elbow,
no.
because a broken elbow is not going to do good either. I think a better thing it would be to roll out of it.
Yes, that's some people.
Mm-hmm.
They always roll down the stairs.
Oh, I don't mean rolling down the stairs. I mean, if I were falling this way, you know, I would try to break my fall with maybe this part of my arm down, not full out like this, because that's going to break your arm. Okay? Anybody else? No? Okay. Thanks for coming today. Appreciate it.
Thank you, Mary. Thank you, everyone. You can see this presentation on our Facebook channel as well on our YouTube. Give me a day or 2 to get it up there. I'm trying to get the newsletter done. So, but thank you so much for being here. We appreciate it, Mary. Thank you for educating us. We appreciate you.
Good information.